Good day, everyone. For today, we are going to discuss about the mitral stenosis. First, let's start with the definition of the mitral stenosis. Mitral stenosis is known as the mitral valve stenosis, and it is the narrowing of the mitral valve in the heart. This defective valve does not open correctly, preventing blood flow into your heart's main pumping chamber, which is the left ventricle. Mitral valve stenosis can cause fatigue and shortness of breath, among other symptoms. So what are the signs and symptoms of the mitral valve stenosis? The signs and symptoms of the mitral valve stenosis includes shortness of breath, especially with activity or when the person lie down, fatigue, especially during increased activity, swollen foot or legs, sensation of a rapid fluttering heartbeat or palpitations, chest discomfort or chest pain, coughing up blood, dizziness or fainting, heart murmur, fluid buildup in the lungs, and lastly, the irregular heart rhythms or arrhythmias. Siyempre, maiisip natin, ano nga ba yung mga causes ng mitral valve stenosis? So, here are some of the causes. The first one is the rheumatic fever. The rheumatic fever is the most common cause of the mitral valve stenosis. It can damage the mitral valve by causing the flaps to thicken or fuse. The second one is the calcium deposit. As we age, calcium deposit can build up around the mitral valve, which can occasionally cause mitral valve stenosis. The third one is the radiation therapy. Radiation therapy is known treatment for certain types of cancer. It requires radiation to the chest area, and sometimes it can cause the mitral valve to thicken and harden. And the last one are the other causes. In some cases, babies are born with narrowed mitral valve or congenital defect that causes problems over time. Some autoimmune diseases such as lupus also may rarely cause mitral valve stenosis. For the complications of the mitral valve stenosis, like other heart valve problems, mitral valve stenosis can strain your heart and decrease blood flow. Untreated mitral valve stenosis can lead to complications such as: first, high blood pressure in the lung arteries or the pulmonary hypertension. Increased pressure in the arteries that carry blood from your heart to your lungs causes your heart to work harder. Second is the heart failure. A narrowed mitral valve interferes with blood flow. As a result, pressure may increase in your lungs, leading to fluid buildup. The fluid buildup strains the right side of the heart, leading to right heart failure. The third one is the fluid in the lungs or the pulmonary edema. In this condition, blood and fluid back up into your lungs, and pulmonary edema can cause shortness of breath and may cause you to cough up blood, think mucus. The fourth one is the heart enlargement. The pressure buildup of mitral valve stenosis results in enlargement of your heart's upper left chamber or the atrium. The fifth one is the atrial fibrillation. The stretching and enlargement of your heart's left atrium may lead to this heart rhythm problem in which the upper chambers of your heart beats chaotically and too quickly. And the last one is the blood clots. Untreated atrial fibrillation can cause blood clots to form in the upper left chamber of your heart. Blood clots from your heart can cause loose and travel to other parts of your body, causing serious problems such as stroke if a clot blocks a blood vessel in your brain. In prevention, the most effective approach to avoid mitral valve stenosis is to avoid its most prevalent cause, which is the rheumatic fever. You may manage this by taking your children and yourself to the doctor if you have a sore throat or a strep throat. Rheumatic fever can develop from untreated strep throat infections. Fortunately, medicines are typically effective in treating strep throat. Now, let's talk about the treatments for the mitral valve stenosis. Treatment is not needed for asymptomatic patients, and for mild cases, it can be treated with diuretics to reduce blood pressure. We can also use beta blockers or calcium channel blockers to control heart rates. We can also use anticoagulants to prevent blood clots. Valve repair or valve replacement surgery may be indicated for moderate to severe cases. For valve repair, we have percutaneous valvuloplasty. It is a catheter with balloon is threaded through a vein and into the heart. The balloon is inflated to widen the opening of the valve, then deflated and removed. Patients with calcification may require open heart surgery to repair the valve. And for valve replacement, it is advisable if repair is not possible. Artificial valves can be mechanical or bioprosthetic. Mechanical valve can last longer, but it requires lifelong anticoagulations to prevent formation of blood clots. And that's all about the mitral valve stenosis. Thank you for listening!